Hi there, my name is Dr. Treasury and I will be carrying out your medical assessment today. I understand that you have some concerns that you'd like to discuss with me. Okay, that's absolutely fine, we'll take good care of you, alright. Just make yourself comfortable as you can, and is it okay for me to take some notes about what you're saying? Good, okay. So I'm going to run through a few questions with you before we begin any kind of examination. I'd just like to cover some of your medical history and some of the things that have been going on, if that's alright. Of course. Okay, so what are the symptoms that have brought you here today specifically? Okay. Yeah. Okay. And how long's that been going on for? Okay, so have you been experiencing any kind of nausea or sickness? No? Okay. And are there any areas in your body that are painful or causing you any kind of discomfort? Okay. Alright then. Have you been experiencing any episodes of dizziness or just generally feeling a bit off balance? No, okay. Any issues with your sight? So any episodes of kind of double vision or... No, alright then. When's the last time you had an eye test? Okay. Yeah. And do you wear glasses generally or contact lenses? Do you have any kind of prescription? And how has your eyesight been lately? Just in general, beyond any kind of double vision, just general watching television and reading. Okay. Any issues with driving at all? Do you drive? Okay. Yeah. Alright. Are you on any medications at the moment? No? Alright. And what about your sleeping? How has your sleeping been lately? Okay. So how many hours a night would you say that you get on average? Okay, yeah. And do you have when you fall asleep, do you stay asleep for the duration or do you tend to wake up during the night? Okay. And if you do wake up, do you find it a struggle to go back to sleep? Okay, no problem. Tell me a little bit about your caffeine intake. How much tea and coffee are you drinking every day? Okay. Yeah. And do you drink alcohol generally? Okay. And what about exercise? Do you exercise regularly? Daily? How long for? Okay. And is that gentle exercise, walking, you quite lovely? Okay. Alright. Just, have you had any sort of slips or trips? Have you fallen over, had any bumps to the head lately? No. Okay. And how has your speech been lately? A bit of a random one, I know, but have you had any issues with forming words or finding the right words to say, or just generally feeling a bit tongue-tied? Okay. Good. And do you suffer with anxiety at all or depression? Some anxiety, okay. Do you have coping strategies for that, or is that something that you struggle with often? Do you feel that contributes sometimes to the struggle to sleep? Okay. Do you find that you tend to have an overactive mind? Okay. Okay. So, headaches are one of those that can be quite tricky because there are so many potential causes for them. There are certainly some things that we can do today, some tests and various examinations I can do to rule out some underlying causes of that. I suspect from what you've said that it's a combination of probably a little bit too much caffeine and a little bit of a lack of sleep that's going on. So I'm going to check to see how well hydrated you are and whether there are any other issues that might be causing you to struggle with sleeping, which might in turn be causing headaches. But before we get on to any of that, there are some tests I would like to do first. So the first thing I'm going to do, if it's okay, just put this one over here. I would just like to check your heart rate. Is that alright? Okay. So how are you feeling at the moment? Are you feeling calm, nervous? Okay, well, there's nothing to worry about here. I'm just going to place this onto your chest and have a little listen there. Okay, so your heart rate is a little bit elevated. It's a little bit higher than I'd like. So what I'm going to do is just ask you to do some breathing exercises for me just while I listen to your lungs. So I'm going to put this against the front of your chest here. There we go. Is that okay? Good. Alright, now all I'd like you to do is just take a long, slow, deep breath in for me through your nose, okay? Okay, go. Good, and then just blow out very gently through your mouth. Good. And keep going just like that, same again. And I'm just going to come around to the back of your chest here, just on your back, and I'm just going to listen again, so just do the same again for me, just a nice slow breath in through your nose and out through your mouth. Good. And same on your back on the left side here, so just again slow deep breath for me and out through your mouth. Okay, just keep going like that, that's great. Good, well done. Okay. Excellent, so your lungs sound really clear, and that breathing exercise just generally just slow deep breaths, focusing perhaps on counting, so count down 5, 4, 3, 2, 1 as you breathe in, and again 5, 4, 3, 2, 1 as you breathe out. That will really help to control and steady your heart rate, especially if you're experiencing a bit of an anxiety attack or anything. The breath is a really great tool just to be able to get on top of it, okay? Good. Alright. I'm going to perform a couple of examinations now, so I'm going to put some gloves on. If you feel at all uncomfortable at any time, just let me know and I can stop. But there's nothing today that's going to cause any pain or anything like that, alright? Okay. So the first thing I'm going to do is check your temperature. I would just like to rule out that there might be any kind of underlying infection that could be causing your headaches. So if you just sit nice and still for me, I'm just going to check firstly by your left temple here. Okay. And the same by your right temple. Okay, so that says that your temperature is perfectly normal, which is what we'd like to see. So that's all good. I'm just going to make a note of that one, along with your heart rate. And your chest is clear, which is great. Now then, in terms of checking your skin and checking you to make sure there are no signs of dehydration, are you happy for me to just wipe your skin clean here just to remove any makeup or any product that you might have on it? Okay. So we don't normally do this, but I just really like to be able to see the condition of your skin, as it can so often point to any underlying issues that you're having with your general health. Okay, so I just have a very gentle cleanser here. And that's got the lovely lavender scent to it as well, so that should help you to relax. So I'm just going to wipe that very gently on your skin here. Okay, just across your forehead there, and down onto your nose, and over your temple on the left side of your head, and the same on the right side of your head, and your right cheek. I have a really creaky office chair today. I hope you don't mind. Okay, so I'm just going to wipe across your chin there. Good, and around your cupid's bow. Okay, good. If you could just close your left eye for me. Okay, I'm just going to wipe the lid there. And the same for your right eye. Just clearing the lid. That's great, well done. Okay, just put that one over here. So I'm just going to get a bit closer up, if that's alright. I will need to touch your skin. I'm just going to have a really good look, okay? Although I'm checking for any signs of dehydration in your skin, I'd also like you to tell me if there are any areas of your skin or your face, muscles that feel at all tender. Okay, so if there's anywhere that just feels a little bit uncomfortable when I'm touching, just let me know straight away, alright? Okay, so I'm going to start here on the left side of your face. Just pressing there onto the skin just to see how that's looking. So your skin does look in good condition here actually. Great. And the same on the right side of your face. Just gently pressing. Let me know if any of those areas feel at all tender, okay? Down towards your chin. Just on your nose here as well. across your forehead. Right, how did that feel? Is that okay? Okay, I'm just going to press in various areas around your head. Okay, so just let me know again if there are any areas that are sore or tender. So just starting on your parting line and working my way down towards your ears. Good, and then behind your ears, down towards the nape of your neck. Does that feel okay? Any pain there around your neck? No? Okay, and if I move up your neck again towards your jawline there, how does that feel on your jawline? Any tenderness? No? Okay, just having a feel of your lymph nodes there. Make sure you've got no swollen glands or anything in your neck. They're feeling all lovely and normal. Okay. How is your head feeling right now? Do you have a headache? No? Okay, good. Right. So your skin's not showing any signs of dehydration, so that's good. I would recommend, however, that you swap a couple of cups of tea or coffee a day out for water, just to ensure you are getting as much hydration as possible, but also to reduce your caffeine intake, because it has a really big impact on our body's ability to shut down of an evening when we prepare for sleep. So personally, I don't drink any caffeine after about 11 o'clock in the morning. I have 1 or 2 cups in the morning and then that's it. I only drink decaf for the rest of the day. I struggle with sleep as well, and I found that really helps me. So just what I'd recommend. See if it makes a difference. But the skin is looking really good and healthy, and certainly no signs of infection, so that's all good. I am now going to just look, if it's okay with you, very quickly inside your nose and your mouth. So sometimes if you have blocked nose or an issue with your sinuses, this can actually transfer and you can feel pain inside your head. So I'm just going to have a very quick look. I don't think this is the problem, but it's best to make sure. So if you just tilt your head back for me. Good. Okay, let's have a look here in your nose. That's great. And the same on this side here. That's lovely. I hope that light's not too bright for you. Okay, wonderful. And same again inside your mouth. Sometimes dental issues or issues inside the mouth can present themselves as pain in the head. So I just would like to have a quick look inside your mouth. Okay, open your mouth nice and wide for me. Good, and say ah. Ah, that's great. Okay, I'm just looking at the back of your throat there to see how your throat is looking. Really good. And just coming around as well and looking at your teeth generally. Okay. Do you have any pain in any of your teeth at all? Just nod for me, yes or no. Okay, lovely. If you could just lift your tongue up for me so I could look underneath your tongue. That's great, thank you so much. Okay. That's all looking really good in there, so I don't think we have anything to worry about in that regard. I am also, however, going to look inside your ears, if that's okay. So I'm just going to use an otoscope. So again, it's a similar thing. If you have an ear infection that you haven't realised, then that can cause headaches and things, although you're most likely to notice a bit of imbalance and some pain in the ears or itchiness. But I am just going to have a look and see in any case. So if you could just look to the side for me. I'm just going to start by looking in your left ear here. Okay. Great. So this one is looking lovely and clear, to be honest. You don't have any kind of obstruction there and no signs of any redness, swelling or tenderness. So if I just palpate your ear quickly. How does that feel? Is that okay? Yeah, no pain. Good. And let's just have a look then. Inside your right ear, so just shine a light in there. Great, so same on this side actually, it all looks really good. So I'm just going to do the same again, okay? How does that feel? Is that alright? No pain or tenderness? No? Excellent, okay. I'll just put that one over here at the moment. Right, okay. So what I'm going to do now is just test your skin to make sure that you're not having any issues with the nerves. So I'd like to test your sensitivity. You should be able to feel this, but it shouldn't cause you any discomfort. There shouldn't be any tingling sensations in the skin. It should just be a normal touch sensation, okay? So I'm going to ask you to just close your eyes, close your eyes, close your eyes. Good. Just keep them closed for me. Okay, now I'm going to touch with this little stick here various parts of your face, and I just want you to tell me if you can feel it. Okay, so just say yes or no. So yes or no. Good, yes or no. Okay, yes or no. That's great, keep going. Can you feel that there? How about now? Okay, good. Keep going for me, just like that. Yes or no, yes or no. Okay. So tell me now if you can feel a soft or a dull sensation. Okay. Is that soft or dull? Good. Okay. That's really great. You're doing brilliantly. Okay. So it seems like all the areas of your skin are responding normally. You have no issues with your sensation and no tingling experienced or anything. Good. That's great. Okay. So what I'm going to do now is a short eye test. So of course one of the main reasons you can experience headaches is if you have an issue with your vision that you haven't realised has perhaps deteriorated over time. I know you say it's been about a year since you've had an eye test, so I would certainly recommend that you book another one in with an optician just to see if anything has changed. But I'm going to have a quick check now. So I would just like you to look straight ahead for me. And I'm just going to see what your eyes are doing, so try to focus on something at the back of the room if you can. And I'm just going to swing the light just either side. See what your eyes are doing and how they are reacting. Good. Now I'd just like you to follow the light for me as it moves across your peripheral vision. So keep your head straight forward looking at me, but with your eyes, when the light appears in your peripheral vision, just follow it across until you can't see it anymore. Okay, are you ready? Good. Okay, so just focus on that light, but keeping your head nice and still. That's great. Keep focusing on that light. I'm just watching what your eyes are doing. So keep focusing on that light. That is a lovely job. Okay, keep going. I'm going to move that light up now. And it's going to come back down again, so just keep focusing on that light. Wonderful. Okay, I'm just going to cover your right eye. Good, so just focus on that light for me. Good, and focus on the light again. Great. And the same, I'm just going to cover your left eye, so just focus on that light for me. And now look at my nose. Good, and focus on that light for me. Just follow that light with your eye. And look at my nose. Good, that's great, well done. Okay. That all looks good, so I just have a little card here. And I'm just going to trace some letters on it. And as I do, I would just like you to focus on what my pen is doing and read out those letters for me that I'm tracing. At the same time, however, I would like you to take slow, deep breaths, okay? So the slower the better. So, okay, what is this one? Good, and breathe in through your nose. Good, and out through your mouth. How about this one? Okay, good. So keep taking deep, slow breaths as you watch my pen moving. And this one. Good. Okay, and how about this one? Well done. Good. This one. Long, slow, deep, soothing breaths. That's great. Okay, I'm going to tap on some random letters now. And I would just like you to tell me what those letters are. Okay, good. Great, keep going. Can you see this one? Yeah. This one? Good. This one? How about this one? This one? That's excellent. Okay. I'm just going to move this a little further back. Can you see this number here above my pen? Okay. Right, let's have a look and see. With your right eye, what's this colour here? Good. I can't see anything in your eyesight that's causing me any obvious concern, but I do recommend that you go and get your eyes checked out just to be absolutely sure. Okay. Alright. Okay, that's all good there. So, how are you feeling right now? Just in this moment here with me. nice to hear that. So what I would like you to do now is just to focus on that feeling of calm and being relaxed. And I'm just going to listen again to your heart rate to see if it's dropped slightly. So just carry on with those slow, deep breaths for me while I have a listen here, okay? Good. Okay, so you can close your eyes again if you'd like to. Just close those eyes for me. Close your eyes. Great. Good. Keep them closed for me and take some big, deep, slow breaths. Biggest, deepest breath you've taken all day. Good, that's it. I'm just listening to your heart rate in. Slow and steady. That's really good. Just keep going for me. Excellent. Try to allow your mind to wander if that's what it wants to do. That's fantastic. You are doing a really excellent job. Just allow yourself to sink into that surface beneath you, and with each breath, just let those muscles relax, okay? Allow any tension to escape. I can hear that your heart rate is just slowing ever so slightly to a perfectly normal, healthy, relaxed pace. Okay, that's great. Just keep those deep, slow breaths going for me. Good. Excellent. Okay. Just put that one there for a minute. So, I'm going to put some alcohol gel onto my hands just to sanitize my hands. Okay. I hope that was okay for you today. Good. Alright. So there are some things that I think that we could do to help you today, especially in terms of the issues you've been having with sleeping. I'm going to refer you to a really excellent sleep clinic that I know. They will be able to do some tests with you and recommend some really good techniques for helping you to sleep better. There are all sorts of factors that can contribute to a poor sleep experience overall, and there are some really clever things that can be done to help you to sleep better and to get a better night's rest. So I will send on that referral and they will be in touch with you to book a stay for a few nights at their clinic. I'm also going to book for you an eye test because I think that we should just rule out the possibility that you need a prescription, as that might be something that's contributing to your headaches. So I think that's just best to do, but otherwise you have a clean bill of health from me, and I'm happy that there are no other underlying causes for your headaches, okay? Good. I will catch up with you very soon when we have those results back, okay? But if there is anything you need in the meantime, or anything at all that's worrying you or bothering you, don't hesitate to book another appointment with me and we can catch up, okay? Great. Alright. Enjoy the rest day and have